Hi there, Shay. This is Melissa. I enjoyed reading your post, and I do agree with you that technology has enhanced the practice of nursing and has helped by making it for quicker response times, time efficiency, and for reducing med errors. And not only that, but I really appreciate hearing that you work with a really cool system that also alerts you to any abnormals pertaining to the patient. Let's take, for example, here you state that the patient has trouble ambulating and may be increased in age and has any skin abnormalities. The system will trigger an order for Q12 returns to make sure the patient doesn't develop any pressure ulcers during their stay. And I think that's great, even though we should automatically know that. Sometimes it's easy if it's just put in there, because not only is it a reminder to us, but also to the CNAs on the floor if it's queued to their care plan. I also enjoyed reading that if anytime there is an abnormal vital sign, that it'll also alert you, and that you were able to get in contact with the doctor right away to help correct the issue. And it took less than maybe like 10 minutes to get a response back, and that you're able to give the medication to your patient. And that's great, because a lot of times, let's say if you work a night shift, you may not have easy access to doctors to, ask them questions in person, hey, this is what's going on, what can we do? Or, what would you like ordered? Which is why I love working day shift, because I feel at least I have access to talk to the doctors. But on night shift, this would be perfect, because you don't have it, and at least you're able to rely, to communicate through either Tiger Text or through, I guess it would be kind of Tiger Text, or directly through their cell phone. Now, of course, with technology, there's a pros and cons, and some of the key challenges that I feel that we do face, and unfortunately, it's just like, electronics, technology is system downtimes. A lot of times, some time is needed for the system to upgrade. Unfortunately, it takes a bit for it to upload the new, stuff to keep the, everything updated. And I think for something like that, it's great for leadership to go in and teach their staff on what to do in case something like that would happen, and where to go to pull up the electronic medical records, and print those out and put them in binders. I know when we switched companies from Caratel to Symphony, we also had to transfer a lot of our charting. So for a while there, we didn't have access to our PCC. So we actually, our managers printed out our MARs, and they put them in binders, and we're able to sign out, our medications and treatments for the morning, or until our system was back up. And even though it takes longer, I'm just so thankful that we are, and now where we actually live in a time where technology is awesome. I found a really cool article that kind of discusses that, lessons learned from electronic health record downtime, by Coffey et al. Back in 2016. And here she states that side effects of system downtime include disruption to clinical workflow, limited access to patient data, increases in patient wait time, staff overtime hours related to re-entry of data, and frustration of staff and patients. I mean, no one likes to wait for their stuff, and especially when you are already, you have a lot on your plate. I mean, charting on paper makes it that much longer. And pretty much it all goes back to improved communication and making sure that leadership does communicate with their staff of, what's going to happen, or if in case something were to occur, that the systems are going to go down. So either way, great post. Talk to you soon. Bye.